Well, welcome to the Okaloosa News part of the Okaloosa Today show. I'm Kathy Newby, Public Information Officer for Okaloosa County, and my guest today, who I would like to welcome, is Dr. Karen Chapman of our Okaloosa County Health Department, or Florida Health Department, Okaloosa County. Welcome, Dr. Chapman.
Thank you.
Well, tell us a little bit about how this works, because we also have the County Extension Office, or a lot of people call it the Ag Department of Okaloosa County. That is a state organization, but we do have it locally here, and it's sort of a partnership. Talk a little bit about that and about who can go to the health department.
Well, the Florida Department of Health is an integrated and centralized state governmental agency, and now we're known as the Florida Department of Health in Okaloosa County. It's still the same organization that you knew as the Okaloosa County Health Department, but it helps show the public that we're part of the state Florida Department of Health.
Which it's always been, and is a huge benefit.
Yes,
to us,
it's
to our
always
residents.
been a state agency, and it actually does have a lot of great benefits because we have resources that we can pull on from the state,
right,
or even from within the region when we have any situation that comes up where the demand is greater than our resources can accommodate locally.
And it helps with the funding and just all kinds of things like that, when you can get funding from the state and from the county. And
correct. That is a somewhat unique relationship in that there is a formal contract with county government to provide services to the people who live in Okaloosa County.
So, well, good. Well, thanks for mentioning that. And let's talk about, I'm always amazed at the great services that you all provide. So let's talk about these. And I know you have an office here and in Crestview, here in Okaloosa.
Correct.
2 offices in Okaloosa County. Let's talk a little bit about that.
Well, we're located at 221 Hospital Drive in Fort Walton, and we're on Highway 90 in Crestview. And both really great facilities. The county does provide us all of our space and facilities, and we really enjoy a wonderful relationship with Okaloosa County. We provide a variety of public health services, and most of the time people don't have any idea what we do.
Or who can even go, can any resident go? And, things like that people just don't, a lot of times people don't realize they can use their health department.
Well, we provide a variety of services, and it just depends on which different customer base uses what services. So, for example, our Women, Infant, and Children's Supplemental Feeding Program is open to anyone who makes 185% of poverty or lower, and helps pregnant women and infants and children up to age 5 get access to a healthy diet and nutritional counseling. Anyone can come and get their birth certificate, a Florida birth certificate from the health department. We also provide disease surveillance services. So in the background every day we're getting reports from the hospital about what's going on. We have systems in place where we can monitor the patterns of what is being seen in the emergency rooms to look for any differences from year to year. We get reports of reportable health conditions from doctors and hospitals and laboratories. We respond to disease outbreaks, whether they are in nursing homes or whether it's in someone reports to us they got sick at a restaurant. So we're always monitoring in the background. We have a large component of our health department that deals with community health improvement. One of our principal jobs is to promote, protect, and improve the health of the people in Okaloosa County. And so a large focus is on helping people understand what our health patterns are and what we have opportunities to improve in.
And education, and that's why I wanted to bring that out, because I think a lot of people don't realize all the great things that y'all do provide, all the things you're doing in the background. And another way that y'all work with the county, which we're going to talk about, is you work with Public Works very closely on mosquito control. And I know that we work together with you all in testing and things like that for local mosquitoes. We're going to talk a little bit about that, and maybe you can give us a Zika update.
Okay. Well, we have long worked with Okaloosa County Mosquito Control. My environmental health unit has a long-standing relationship with them. And you know, as we enter into mid-spring and summer, it's really important for our families, our residents, to understand how important it is to take precautions against mosquitoes.
Drain and cover is what we
Drain and cover, that's exactly right. You know, mosquitoes can carry viruses that can cause some human beings to become sick. And we, for many years, had a virus called Eastern equine encephalitis, and there's one called St. Louis encephalitis. And, you know, occasionally we would have a case. Back in the early 2000s, we had the entry of West Nile virus into the state of Florida.
Right.
And then there's been new viruses introduced in South Florida, which haven't made it up here yet, like dengue and chikungunya, that are also carried by mosquitoes. And most people are probably hearing about Zika virus right now. And Zika is somewhat like dengue and chikungunya, although it causes less severe disease. It's of heightened public health importance worldwide right now because of this potential association with birth defects.
It's not one to be alarmed over right now in Northwest Florida, but certainly one that needs to be monitored. And certainly if you travel, that's the main thing. We want to get education out to those people who might be traveling to South America or...
it'd be Central America, South America, and the Caribbean islands, including Puerto Rico, are areas in where there is active Zika transmission. As of this afternoon, we have 76 cases of travel-associated Zika in Florida. And most of those individuals live in Central or South Florida. We did have one case of Zika up in Northwest Florida very early on.
And it was travel related also.
All the cases reported in Florida so far are travel related. You know, Zika produces generally a very mild illness in human beings. And so only 1 in 5 actually gets sick enough to present to a doctor. There have been no deaths associated with it, and it doesn't result in hospitalization, unlike West Nile virus. People do get sick and go into the hospital.
Right. It's a lot like cold symptoms, isn't it?
It's you know, generally fever, a low-grade fever, possibly a rash, eye infection symptoms.
Okay.
We're currently recommending that anyone who's planning on becoming pregnant, but particularly pregnant women, should not travel to those areas where there is Zika transmission.
Right, it's more of a risk for them.
Yes, because a risk because we don't know yet, and the CDC is studying if there is an association between this virus and the birth defect called microcephaly. So at this point, the CDC is recommending that pregnant women avoid traveling, and that pregnant women be cautious about sexual relations with partners who have traveled there and may well have contracted the virus. So it's really important to get the word out.
Yes, and that's
that
what
regard.
we want to do today is educate, definitely. Okay, and then when we talk about drain and cover, and we do test certain areas too in the county when we're talking about mosquito spraying. They'll test certain areas, and if they need more spray, need to be on the schedule more, then we'll do that. But that should begin in May, but in the meantime, we always tell them to drain any standing water. I mean, I don't think we can say that enough in your yard. I think you said that a magnolia leaf could hold enough water to breed mosquitoes. Is that?
You only need a bottle cap full of water to actively breed this particular set of mosquitoes that carries Zika, dengue, and chikungunya. Now, I want to really emphasize that in the United States, it is a much lower probability, particularly in the continental United States, that we will not get sustained Zika virus transmission.
Right.
And that's for a couple of reasons. One, we have air conditioning. We have much better sanitation. And throughout Florida and much of the country, we have more sophisticated mosquito control efforts. And here in Okaloosa County and in our surrounding counties, we do have well-developed mosquito control. And in fact, mosquito control does monitor different sites to count the number of mosquitoes they're seeing, as well as the breeds of mosquito, the species that they're seeing. And so we're fortunate that we have that sort of information. But as we move into May and April, May, we've had a lot of rain and then it warms up. We are really encouraging that this mosquito, the mosquito that carries Zika, it also can carry chikungunya and dengue. That mosquito likes to live around people. And our county mosquito control does great work in keeping the mosquito populations down through the fish program, the Gambesi fish program, and with spraying. But what's important is that people need to know that they need to take efforts themselves around their house to drain water and cover anything that can collect water. That
Right.
You're your own best advocate for keeping mosquito populations down around your house.
Yeah, make sure your screens are
All repaired,
Yes,
if you're going to
those
leave
types
the
of
windows
things.
open, and then use an EPA-approved repellent,
Yes.
mosquito repellent.
And of course, make sure those are safe for children. No babies under 2 months of age, and adults
Yes.
should apply that to their children. They should be the ones applying
Right,
that mosquito control.
right. If your child can't apply like sunscreen to their face without getting it in their eyes and the mouth,
Yeah.
then they can't apply mosquito repellent to
Right.
themselves. And no child under 2 months should have any mosquito repellent placed on them. And in fact, really recommend keeping those very young infants inside, or keep them covered and use mosquito netting on their
Baby carriers.
Baby
yeah, they do
carriages,
have that
yes.
available.
Mhm.
Okay, all right. Well, that's very good. We'll move on to some of the other public health issues. You were talking about the, let's see. Well, the Community Health Improvement Plan was a committee throughout the county that sort of really implements some of the Health-Okaloosa initiatives. And then we have the County Health Assessment Committee that really looks at the overall big picture each year to get ready to hand that off to the County Implement Plan Committee. Is that that's the best way to say that, I think.
Right.
Let's talk about
About
those two initiatives. They're very important.
About every 5 years, we do an analysis of the status of health in our community. And we work with community partners to look at what's going on. We did that first analysis back in 2011. And out of that, 3 community work groups came together around access to care, healthy lifestyles, and tobacco cessation. And over the past 4 years, those groups have worked very hard in implementing policy and environmental changes to help people live healthier lives. A great example around tobacco was the school district adopting smokeless campuses, and also adopting a policy where students were not suspended from school, but in fact had in-school suspension for tobacco violations, and had to take a tobacco course to understand the perils of smoking. So that's an example of how a community group can impact change and improve health outcomes in the community.
Right, and they had 3 community priorities. Tobacco was one, healthy lifestyles, and access to care.
Correct.
And then they came up with a 5210 initiative, which was pretty interesting, and they did that through the schools and child care facilities.
5210 is an evidence-based community intervention that looks at changing policy and environment in a variety of settings. We started in child care centers, and we have worked with about half of the child care centers in Okaloosa County, and I'm very proud of the child care centers that have been involved. These child center directors have been implementing changes in their child care setting that take small steps to leading a healthier life. And 5210, what does that mean? 5 means eat 5 or more vegetables and fruit per day. 2, limit the recreational screen time for you and your children to no more than 2 hours a day. Be physically active at least 1 hour, 60 minutes a day, so that's the 1. And then 0 for us is cut back or eliminate sugary beverages and eliminate the use of all tobacco.
Great program, and I know that y'all have had great success with that. The health department's done so much, with these 2 committees. Let's talk about the health outcomes and the health factors in the counties in Florida, specifically Okaloosa.
Well, an interesting thing is for the past 5 or 6 years, the Robert Wood Johnson Foundation has released rankings of counties by state as far as their health outcomes versus the health factors. Now, what does health outcomes mean? Well, that means we're looking at the length of life and the quality of life, where health factors are looking at our health behaviors and our social and physical environment and how that impacts on our health. Okaloosa County has consistently, over the past 6 years, ranked in the top 25%. We were 12th in health outcomes and 18th in health factors. We have slipped a little bit in health outcomes, though. We're not as strong, and that's principally because we have more premature death. And the major causes of death in our county are cardiac, heart disease, cancer, strokes, and lung disease. But the 3 biggest contributors to premature loss of life are cancer, heart disease, and infant mortality.
Well, we are going to have to close out this show. Thank you so much, Dr. Chapman,
You're
for
welcome.
joining us. And please join us next time on the Okaloosa Today Show.
Thanks for watching Okaloosa Today. Join us again next month to learn about local news and information for Okaloosa County, Fort Walton Beach, and Destin.